Minimally invasive surgery is replacing traditional surgical procedures whenever possible. The role of lasers is also playing a major role. Dr. Charlie Hahn of Vanes, Florida, explains how laser treatments, also known as thermal ablation, have, during the past 10 years, replaced the often painful procedure of vein stripping.
For our new ablation procedure, even for microphlebectomy, it takes really minimum sedation. It takes a very short period of time to do, usually about 30 minutes, 40 minutes. Patient go home same day, usually really not much pain after surgery. All the incisions are very small, very minuscule, and heal very nicely. It can eliminate almost all those unsightly veins and swelling and pain patient experience. Ablation process means we destroy the vein that has the valve problem. We can use different energy source. Most popular laser, we place the device into the vein, which is usually the saphenous vein. And once inside the vein, the device will heat up and then will damage the lining of the varicose veins, and then will make it shrink and eventually go away. We prevent the excessive blood flow from coming back reach those varicose veins. Blood flow used to be back up in the vein would now be rerouted to the deeper vein, which will be back to the system. Ultrasound guidance, it's usually only about the one needle incision. It has minimal blood loss and really minimal pain and post-operative recovery time. Usually I advise my patient to elevate the legs about 48 hours after surgery, and then subsequently they can get up and move around. And usually they don't have much pain. We still tend to do some stripping, but instead of the whole length of the vein, right now we just do microphlebectomy, which is only for large varicose veins locally. For those large varicose veins, not the saphenous vein, we make a tiny little incision and use a special instrument to pull them out. And that can achieve a great success by removing the vein immediately. We can clean up the whole leg within a shorter period of time. Cryotherapy is to inject those spider veins with a vein solution. We use the vein solution. It's a very mild form of irritant. It will get into the vein, irritate the endothelium of the vein, and cause the small vein to collapse and subsequently be absorbed by the body.
Thermal ablation is associated with high success and low complication rates. The procedures are generally performed on an outpatient basis with local anesthetic and typically require no sedation, and the recovery time is short. For more information on Vanes, Florida and their various vein treatments, follow the Laser Procedures story icon on our homepage at yourhometownhealth.com.